Conversation in a Tack room. Elizabeth Yule, DVM, PhD, Deep CVP. Jean-Luc Cornille, Science of Motion.
We start with you.
Okay. Jean-Luc and I have been talking about basically prevention versus management. You're looking at first how to prevent lamenesses and development of chronic arthritis, and then what to do once it's developed and how you manage it. One of the things that the prevention is how the young horse has been started. And unfortunately on the necropsy floor, I've been seeing some cervical arthritis in quite young horses. And they may actually be more susceptible to it because their growth plates in the cervical vertebrae aren't entirely closed, even probably up till about 5. So they may be more susceptible to compression on the neck. So it becomes really important. It's also, you saw it with Happy, where if you've got these big moving horses that have to basically figure out their bodies just like a human child who's becoming an athlete would have to do, and it's what the coaches do is to help them do that. So we really need to move to that type of individualized movement to get to prevention. If you look at the graph that we've posted, you'll see that one of the problems with diagnostics these days is that the focus, they're really, in essence, they're diagnosing the lameness too late. And if you look at that red line across there, that's when the tissue has started to fail and you're really seeing a problem. Before that, you may have a gait abnormality or a movement dysfunction that's putting too much force in a certain area in the horse, whether it's the neck or the spine or the legs. But the body has the ability to compensate for that to a certain point, and that's what that line going up is. So you've got mechanical forces on the tissue that are the body has to respond to, and at first there are things put in to compensate. So some of the compensations may be changes in the stride. You may pick that up in a horse that isn't performing quite as well as it used to, although it's not what is considered overtly lame. That's still a sign that something is going on. And the goal is to really analyze the movements and correct the dysfunction early. So what we have to do is to really learn how to identify gait abnormalities and problems much earlier than we are. And then you can prevent the really overt and awful tissue damage that can occur, and also enhance the horse's athletic career. So that's the idea of prevention, which is when you're starting a young horse, they're not moving perfectly. I had a young mare that she's a beautiful horse, but she had a pretty pronounced transversal rotation. And if that wasn't fixed, and we fixed it as she went along, and her gait became much better and beautiful. She used to cross canter and have her feet slip out from under her when she tried to turn sharply against the rotation. And she had that. So to expect these young horses to be moving perfectly symmetrical and perfectly as soon as they're born is not correct. And then, so you have to analyze the horse very early and start to work to fix the issues that you're seeing in order to prevent lameness. Now with my mare, if they hadn't picked up on the transversal rotation and they just tied her head down with side reins or something else, she would have gone lame. She probably would have developed cervical arthritis and other things. So the prevention comes from looking at the horse and figuring out what you need to do.
The prevention demand to think a lot. As a rider, most of us can figure that, can ride well. The problem is to think differently. We are trained to condition horses to stereotype, and we apply those stereotypes, and that's what damages the horse. We need to analyze each horse. We need to consider that the horse is willing, inherently willing, but he had to protect his body. And that are the reactions that we judge because they don't fit the stereotype. We have the skill to do it. We have the intelligence, but we have to think differently. We have to approach the equitation from a completely different perspective. The wisdom of our ancestors is useful, but we should not repeat what they did. We need to upgrade what they did to the level of performance we have today, and also the level of horses. Horses today are more powerful, bigger mover, more difficult to sit, and we can no longer do it the way we used to do it. We need to coordinate their body efficiently, so efficiently that they become comfortable. If they are difficult to sit, uncomfortable to sit for the rider, they are not comfortable in their body. They are on their way to develop a problem. And for the comfort, it's an important part. So instead of being guilty because we have difficulty to sit, we need to think why the horse is not comfortable, what is the problem. And to do that, we need to tailor to each individual. We have the capacity to do that. We need to refine our perception, but our physical intelligence does that if we focus on, if we concentrate on feeling the horse. We start to feel more and more and more. But the most important is not the perception. Feeling is just a perception. The most important is what you think about this perception. So if we feel something and in our mind we try to fit it to traditional thinking, we never find a solution. The horse tells us the problem, but we don't find it because our brain, our mind is not focusing on that. So the key is there. We need to think differently. We should not think submission, obedience, that antiquated. We need to think the horse is willing, but need to protect. And the horse tells us what to do, but it is completely out of the book. We need to be open, we need to be willing to think in a different direction and explore. And therefore don't be afraid to make error. Error are normal. Error is the way we learn. Same for the horse. And if the horse is punished when he don't do well, the horse is afraid to explore. They have to explore because a lot of the coordination they do is out of our control. The close kinematic chain, the fascia line, all this new knowledge makes it clear that the horse coordinates their body on a much more sophisticated level than our ancestors believe. And therefore a great part of the processing belongs to the horse. We just create a condition who allow the horse to process. Then how we know if the horse processes in a good direction or in a bad direction, that is our knowledge, our understanding of the athletic performance. We need to have, and that's what biomechanics did very well, we need to have a sound understanding of how the horse body works. But what biomechanics don't do well is to apply biomechanics. To apply biomechanics, we need to go to biotensegrity. We cannot do it from part to create the whole body. We have to go the other way. We have to use the whole body to gradually improve the coordination of the part. So we need to ride differently. We need to ride more with a tone of our body, subtle nuance in muscle tone, involving our entire body all at once, instead of the head, the legs, the hand, the detail, the fixing the body parts, thinking that will fix the whole. That's a major evolution. and it is not difficult. It is difficult mentally because we are used to think differently, but it is easier for the rider. I see numerous riders when I teach were in trouble with a biomechanical approach and became realized that they are perfectly capable to do it when they liberate themselves from those priorities and start to think the entire body. Start to think positively, start to think that the horse will willingly respond when he will feel comfortable with what we ask. So there is a wonderful partnership we can develop. We all the capacity to do it, but we need to think differently.
And the thing is that this isn't that new in terms of trying to understand things. It's new for the horses, but it's more and more becoming the way that human therapists are going. So somebody comes in because, let's say they've got a problem in their back or in their neck, and they're working on their foot. So more and more, this whole body approach to figure out how is the whole body functioning in a way that puts increased stress on this particular joint is the way to go. The reductionist approach, which is and I always ask people what comes first, the lameness or the lesions? And too often I get the answer, the lesions. The lesions cause the lameness. And I get this, so I'll look at them and I'll go, how did the lesions form? Spontaneously? What caused the tissue damage? And what causes the tissue damage in these chronic degenerative conditions is mechanics. And that's coming out more and more and more. But we have to get away from the idea that an injection or a surgery is going to fix everything. Some of that's still in human medicine where they can actually replace a joint. So people will have their knees replaced and then they think that's it. It's going to be functioning absolutely perfectly and I can go back to what I was doing all the time. And it's like, no, you need the physical therapy to really become functional. So a lot of when we're getting into what do you do once some lesions have developed, that the horse is starting to show more and more problems? Well, first off, the first time the horse needs to be injected should be like a fire alarm. It's like, okay, why did this horse have to be injected? Are there problems in this area of the body? And that's something that the rider and the trainer have to look at the horse and be able to say it's moving in a way that puts increased stress on whatever it is. It's kissing spine, it's hyperextension of the spine. Cervical arthritis is related to compression of the neck. Lamenesses like navicular and others are related to overloading of the front legs. What's causing that? Don't just cover it up. And again, a good physical therapist, human physical therapist, would be looking at the whole body function, and more people are aware of that. The horses are desperate for the same approach. And it can be done, but we've got to let go of it's a lesion, let's just try to fix the lesion. Well, we can't fix the lesion. The lesions are a tissue response to increased mechanics, and unless you get the mechanical forces off, the aberrant forces off that area, you're never going to fix it. They're going to continue to get worse. You can block the pain, but you can't fix them. So, but that doesn't mean, I'm getting more and more hopeful, that actually, and this is a lot of medicine, if you get things set up so the body heals itself, the healing response is a response in the body. So if we get the mechanics right on some of these conditions, I think first off, the lesions won't progress, and there's some evidence that you may start to see some healing. Now, is the joint going to go back to perfect? Probably not, but it can certainly go back to functional. And some of the changes we see, where we see bone, osteophytes, we call them, bone forming around the joint, those are actually compensations. Those are compensations for too much stress on the soft tissue. So they might stay there, but it doesn't mean that the horse couldn't be functional. And again, it's not an approach that's been used that much, but there's already some evidence that even things like articular cartilage can start to heal if we get the compression and the mechanical forces off it. So this also brings up, we talked about prevention with the young horses after, so yes, you start with prevention with the young animal, and then you have a combination of, I would call it prevention and maintenance, because you can't also take the attitude, well, okay, the horse had this problem, I fixed it, and everything's fine. You've got to continually monitor what's going on with that horse and how it's moving, because it's going to change over time. It's going to change as you train the horse. You can't just you can't say, okay, it's fixed, I don't need to worry about it, especially if a horse has shown a tendency to develop a lesion in a certain place. You've got to be vigilant about it, and that's maintenance. Maintenance is also what is used to heal the horse or try to resolve the problems of a horse that's got chronic lameness. So really it's prevention in the young horse, and then it's, if you will, preventive maintenance all the way through the rest of that horse's life. And again, John, nobody does it better than John Luke.
The physical therapist for the horse, it's mostly the rider. Here is why. If you have a problem with your wrist, the therapist will make you touch your finger a certain way to create a certain response. You understand that, you understand the reason for that, and you do it. The horse does not. The horse protects what he's used to do. And when he has a problem, he protects the problem. And therefore, it is necessary to work the entire horse and the mental processing to find a way to make the horse comfortable doing what is useful for the rehabilitation of a joint. That is to be adapted to each horse. That it is a completely different psychology. The horse will protect his problem, not work it. And therefore we need to encourage the horse to explore a coordination, a way to use his physique, which is going to correct the problem. And each horse reacts differently, so the approach, we might have to take the tour, because the horse will protect, and the approach is prepared to each horse. But that is where the rider is so important, because the entire body have to function to make one joint function efficiently, and it is different for each horse. There are many protections, different morphology, different muscle imbalance, and they have to be adjusted for each horse. And also the processing, what Betsy just said, the horse will react protecting what is comfortable to do or not afraid to do. So that's a normal reaction, and we cannot force him. We have to find a way to encourage him to explore. So it's a very intelligent and gentle partnership. He works because the horse is willing, amazingly willing. They are ready to try everything, but also they protect. So that's the way we think is different. We need to find a way to encourage the horse to explore a movement which initially the horse protects. And therefore we might have to take a detour. I had the horse, he could not trot. And the bending, lateral bending, was impossible. But he was ready to flex the spine longitudinally. So I asked him to do that, just to create a relation. And when he realized that I was not against him, I asked him to do something that was easy for him to do. I observed that at a certain degree of longitudinal flexion, some lateral bending was possible. And that way I approached the problem. So I did not directly approach the problem. I take a detour which was necessary to gain the confidence of the horse. So that was the application, the physical therapy for the horse. It's complex, and the rider, if knowledgeable, the rider is the one who are the most likely to succeed, considering the complexity of the problem.
And one of the things also to be very aware of is that that movement patterns get embedded, if you will, in the fascia and in the myofascia, in the muscles and the fascia, and even how the bones respond. So a lot of times these movement patterns, the wrong ones and the right ones, will get embedded in the horse's body, just like they do in the human body. What they're finding is that so changing these movement patterns is not that easy. It takes a long time to have the fascia in particular remodel to a new movement pattern. You also need to realize that fascia is the biggest organ in the body and it's the least studied. Our models for how muscles work was simply about how muscles attach to bones rather than how they attach to each other and how they attach to the fascia. But what they're realizing in human athletes is that it's not, when you want to start to fix things, you don't focus on what an individual muscle is doing. What you want to do is change the embedded movement patterns. And anybody who's tried to do that themselves, and you know that slouching is bad for your back and bad for your neck, but it takes a long time to embed, if you will, a myofascial pattern in you that doesn't include slouching, because your whole body will remodel to that movement pattern. The hopeful sign is that you can change that. You can, even if you have a really bad movement pattern embedded in the body, you can gradually change it. However, it takes longer to change fascia than it does to change muscles. So if you're working, that's what John Luke was with that horse. First off, you have to find a way in that can help. And again, the horses, they're going to protect their dysfunction, but basically they're also stuck in a movement pattern that's embedded in their body. So, you find a way to poke at that movement pattern and try to change it. But that's, realize that that's what you're doing. You can't say, well, I'll build this muscle and all the problem's going to go away. That's not going to work. You have to change the movement patterns that are embedded in the myofascia in the tensegrity aspects of it.